Our guest speaker today is Tiffany Wang, a dermatology and aesthetics physician assistant. Hello, Tiffany. Say hi to everyone.
Hi, everyone. I'm Tiffany. I'm a dermatology and aesthetic physician assistant. I also do wound care, and I'm excited to share with you guys about some skincare things and how to become a PA that you guys are interested in hearing. Next. So a little bit about me. I graduated from University of Maryland, College Park with a Bachelor's of Science in Nutrition. I then worked as a medical assistant in family medicine and then dermatology afterwards, and then took 1 year of gap year while I was doing that, and got into a PA school in Southern California, University of Health Sciences. So I ended up moving to LA to get my master's degree. I graduated salutatorian, and then I started my first job in dermatology. With COVID, that didn't really work out for me, but I ended up going to another derm office and also am working with a plastic surgeon for aesthetics. I also completed a dermatology fellowship through the Society of Dermatology Physician Assistants because I wanted to learn more about dermatology and skincare. And with just like med school and PA school, you don't learn too much about dermatology when you're in your program. So it's really about on-the-job learning as well as trying to complete like a fellowship like I did, or finding a good mentor to teach you. Next. Okay, so a little bit about what is a PA. PAs is also known as physician assistants. We are medical professionals who diagnose illness, develop and manage treatment plans, prescribe medications, and often serve as a patient's principal health care provider. We have thousands of hours of medical training. Not only are we getting experience before PA school, but even as medical assistants, we're getting a lot of hands-on medical shadowing and medical hands-on training before you can even apply. PAs are versatile and collaborative. We are able to practice in every state as well as in every medical setting and specialty. So as long as you can find a doctor that is working in a certain field, you can work with them and be their PA. We do graduate with master's degree. There are some programs now that are doing doctorate degree. So on the right side, I just went over a little bit of what PAs can do. You can do a lot of things. You can take medical history, you can diagnose, you can prescribe medication, you can do research, you can assist in surgery, and you can even do some procedures. So you can't do like the big surgery, but we're able in dermatology to do excisional, biopsies, which is a little bit more of a bigger procedure to get rid of skin cancers. So you are able to do a lot as a PA. And I did take this information from aapa.org, which is the physician assistant, like the website, the official website for physician assistants. Next. So how to become a PA, there's a lot of steps, but this is kind of just like a little basic. You can start off with first getting a bachelor's degree in any field. So it doesn't matter what field you choose. I chose nutrition just because a lot of the classes that you had to take and prerequisites for nutrition actually ended up being very similar to PA. So I didn't want to have to take a bunch of additional courses. But if you love something like, I don't know, like literature, or you want to be an English major, you can totally do that. And then just make sure to complete your prerequisites. It actually makes you a very diverse applicant, so it's not a bad thing. And then make sure to complete all prerequisite courses. So every school is kind of different, which is the tough part when applying for PA school. Every school has, like, one school wants a certain type of psych class, another school wants like organic chemistry. So just make sure you're reading the requirements of each school. What I did was I made an Excel sheet and put in the prereqs of each school that I was interested in, just to organize things out. And if there was some school that had some classes that I for sure was not going to take, I would just eliminate that as an option. And then make sure you shadow PAs, nurse practitioners, and doctors. PAs, you definitely want to be shadowing some PAs, the more the better. If you can find some in different specialties as well, that would be great, just because as a PA, it's pretty different what you can do from one specialty to another, and also between one doctor to another. So that's a good thing to know. And then also shadow doctors and nurse practitioners, because they are going to ask you why you chose PA versus the other. Don't just say you want to help other people, because you can help other people with everything. And then make sure you get patient care experience, 1,000 to 2,000 hours minimum. The more you have, the better your application looks. And then make sure to attend an accredited PA program and pass the PANCE exam. Next. So just want to go over a quick basic skincare regimen that most people can follow. So in the morning, you can use gentle cleanser. You can use a serum, so it's just based on your skin concerns. So if you want like brightening, you can use vitamin C, niacinamide, kojic acid. Vitamin C also is an antioxidant, so it will protect you from the sun. So you always use that in the morning. You use a gentle moisturizer after that, and then sunscreen. So a lot of people think with acne, when you have dry skin or with oily skin, that they don't have to use moisturizer anymore, but that's actually the opposite of what we would want you to do, because your body ends up creating more oils when your skin is dry, because you're not using moisturizer. So then you end up having oily skin when you didn't really have oily skin to begin with. And then everyone should be using sunscreen. I am going to talk a little bit more about the sunscreens that I recommend. There's so many different brands. Really, the best sunscreen is one that you use. And then for at night, you just use a gentle cleanser. And then I always recommend everyone to be using a retinol or bakuchiol. Bakuchiol is a retinol derivative. It works very similar as retinol, but it's not as irritating. So, and you can even use that when you're pregnant. So when you're pregnant or nursing, you never use retinol, but bakuchiol is safe to use. And then afterwards, always gentle moisturizer would be good. Next. Okay, so I kind of just went over some options for you guys if you guys wanted to see like cleansers that are pretty affordable. There are things that you can get over the counter. So for dry normal skin, La Roche-Posay and CeraVe both have really good options that I love to recommend to people. CeraVe hydrating cleanser and the La Roche hydrating gentle cleanser as well. I do like the La Roche a lot for acne patients because it has prebiotic, which feeds the good bacteria of your skin. So acne, a lot of the reasons why you have acne is inflammation, bacteria, and oil, excess oil. So if you are using La Roche, it does have that prebiotic to feed the microbiome of your skin to make it healthy. And then for oily and normal skin, there's the foaming facial cleansers that La Roche and CeraVe have as well. For acne, I do really like their acne foaming cream cleanser. It's a benzoyl peroxide wash. It's 4%, so it's not that irritating. You can use it once a day. Or the renewing salicylic acid cleanser, and those are both for acne. They're just different options. Benzoyl peroxide actually targets the acne when you do have acne already. Salicylic acid is more preventative. Next. And then just like, these are just some skin brighteners. Vitamin C, CeraVe has a good one. It's pretty affordable as well. I think it's like $20-something. And then The Ordinary, which is famous on TikTok right now, is they have a niacinamide, which is really good. The only thing about Ordinary is, yes, it's cheap, but it also only has like one ingredient in each of their bottles. So you end up having to buy several bottles of The Ordinary to do one thing. So there's a lot of products now that are medical grade, and they have niacinamide and kojic acid and like all the good stuff that you would want combined into one product. Retinoids for over the counter, there's La Roche Epiclar, which is adapalene. Both of these are adapalene. They're just retinoid. They used to be, the different one used to be prescription grade, and now it's over the counter. So that's like a good gateway into using a retinoid, especially when you're at a younger age. So both of them are good. I do recommend those. Next. And then moisturizers, these are just some brands that I really like. CeraVe PM, I love that because it has ceramides, which help restore your lipid barrier of your skin. And it also has niacinamide. I do love niacinamide because it's calming for your skin, soothing, it helps with the redness. And then on top of that, it also helps with the even tone correcting. Like it evens out your skin tone. The Neutrogena Hydro Boost, I do love that as well. They have one that is unscented, so it's more natural. And that one is like good for if you have really dry skin, it doesn't make you feel too oily, as well as if you have oily skin, it doesn't make you feel even more oily. The Tolerant Ultra is also very sensitive, and the Kiehl's, I thought that one was a good one too. It's very lightweight. And there's many, many moisturizers. These are not the only ones. These are just the ones that I have liked and I included in the presentation. And for sunscreens, these are some options that, so when it comes to skincare, I always say don't spend too much money on your moisturizer as well as your cleanser. Those, even if you're buying like $100 cleanser and moisturizer, it's not going to do much more for you than something that you can get over the counter with therapy. But for sunscreen, I do think that you should get something a little bit more, as well as a serum. You also want to spend more money on it because that's the active ingredient that you're putting on your skin. So you want something good. For sunscreen, there's two options. You can either use non-tinted or tinted. I do love tinted just because I use that as my makeup. And right now with wearing masks, I try to tell everyone not to wear makeup because it's very clogging and it can cause acne from wearing your mask and then having moisturizer on it and having makeup. So I do like using the Elastin one. It's a really good tinted sunscreen that just matches for everyone's skin tone. La Roche is also really good. They also have a tinted sunscreen. Elta MD is one that I recommend for all acne patients because it has zinc oxide, and all these actually do, but this one is specifically known to help with acne prone skin. So that one is great, and it's non-tinted. And it doesn't really create that white cast. So mineral sunscreens, a lot of people don't like it just because it kind of causes you to have like a white cast on your face and it doesn't look too natural, which is why these are all, I think they're really good. So those are just options for you guys. And then next. And then I just want to talk about something very important because we are living in California. So we are very prone to having skin cancer because we're all out in the sun. So everyone should be wearing sunscreen every single day, even when you're indoors. There is UVA and UVB going through the windows when you are just inside. So a little bit about moles. What to look out for is the A, B, C, D, E's. A stands for asymmetry. So if you see on your mole that it looks asymmetric, it's not just one shape, then you should go get that checked out from a dermatologist or dermatology PA or a nurse practitioner. If the borders are irregular, that's another thing to look out for. So there's a picture here on the right side. It just kind of shows what irregular means. And also, like, if you have an irregular mole from birth, most likely it's okay. But if there's anything that you're concerned about, it's better to go see someone. C stands for color. If there's more than one color, it doesn't look pretty. Usually we just say, look for the ugly duckling. If there's one mole on your body that looks much different than the rest, then just go make sure to get that checked. And skin cancer screenings, you should be doing that once a year, just as a preventative measure. D is diameter, so anything that's greater than 6 millimeters, which is also a pencil eraser tip. And then if it's evolving. So if your mole is changing over time, and make sure to go see someone to get that checked out. Okay. So any questions? There's a lot of questions. I see them on the
Thank you so much, Tiffany. Yeah, thank you for the presentation. There's a lot of questions coming in. And I did also receive an overwhelming, I want to say at least 120 questions that was submitted on our Google form. And thank you for answering most of those questions. So I guess we'll start off with the first one here that one of our guest audience members asked. Why did you choose PA over medical school or nursing?
So I chose PA school because I originally actually started wanting to be a doctor. And then as I was going through sophomore year of college, I was just like, oh my gosh, I don't know if I can like keep studying for this long. A part of it was that I honestly didn't even know what a PA was at that time. So I thought that that was the only route to be able to practice medicine. So I basically, when I found out about PA, I was like, wow, like you can do a lot of the same things that a doctor can do. Obviously you have to be working with the doctor, but you can still, as long as the doctor lets you, you're able to do a lot of it. And then as well as it's shorter amount of time that you can start. I did want that work-life balance. And then I do love that as a PA, you can practice in many fields. Like I think the fact that I'm in a plastic surgeon's office, I'm in a dermatologist's office, I'm working in wound care, I'm working in a med spa is like, you can't do that as a doctor. I'm in multiple specialties at once because that's like the beauty of being a PA. And on top of that is I just wanted, I wanted to be finished at a certain age. Like I really just wanted to have a family, and I know as a doctor you can. I just didn't think that was the right route for me. Nursing, it's very different. I wanted to be the person that was like coming up with a diagnosis, coming up with a treatment plan. So nursing is a little bit different than that. So that wasn't what I was looking forward to.
Thank you for that. And what's the reason why you chose dermatology?
So I actually decided I wanted to do dermatology even before PA school. I started as a family medicine medical assistant for about like almost a year. And then I ended up switching to become a dermatology medical assistant. And the dermatologist was always like, you should be a derm PA. Like you can do everything I can do. Just like, she was like, it's such a good option. Like I'm going to tell my kids to do it. And then I just loved the job. Like I thought it was so much fun. Like sometimes I would be there for 10 hours and I just felt like it was like fun. Like I was hanging out with friends and like, I enjoyed it. And family medicine, I felt like I hated my life, to be honest. So like when you have to enjoy something. And I think when it comes to your career, you can kind of tell from, you're there every single day and your coworkers, what you're doing is like your daily job. So I wanted to make sure I loved it, and just loving it as a medical assistant already, I was like, wow, like I can see myself doing this in the future. Like I'm going to pursue it. So I ended up doing all my elective rotations in dermatology and plastic surgery. And then I applied like crazy to get into dermatology. It's not easy, but it's totally doable.
That's wonderful. Would you be able to walk us through your typical workday in a dermatology office?
So right now, since I'm at a few jobs right now, I can kind of go, which one do you want? Like dermatology, med spa, plastic surgery?
Let's do dermatology.
Okay. Yeah. So for the most part, it's just I just go in, like make sure everything's ready for the day, patient schedule, and then I just have like about 2 patients per hour, and then I'm seeing like acne patients, rosacea patients, skin checks. It just really depends on, and then I do some cosmetics as well. So every day is a little bit different, but yeah, I'm still learning too. So I'm pretty new in the dermatology world. I've been in the med spa and like plastic surgeon a little bit longer than derm. So a lot of it is still like training. Like I still like most likely going to be seeing patients and then like talking to the doctor about treatment plans and then just making sure that I'm good to go. Yeah.
Okay. Jennifer here asks, what do you think of the inky list? I'm not sure what that is. If you could just tell us a little bit.
I've heard of it before, and I've heard some products of it is good, but I haven't tried it for myself. So I think people had said the retinoid is pretty good, or the retinol products that they have. But it's really just like looking at ingredients. There's so many brands, it's hard for us to know like every single one, but I have seen it. I think it's on Sephora. Like they sell it through Sephora, and then I have seen people talk about it before. Yeah.
Evelyn here asked, I've read that it is not recommended that people with darker skin use sunscreen because their skin needs to absorb more vitamin D. Is this true?
No, that is not true. So sunscreen use is everyone. In the past, I used to think that people that were Asians or like Hispanic or African American like did not need to use sunscreen because that we have natural melanin in our skin and it's preventative for skin cancer. And then I learned that it's completely wrong, especially since we live in California. So everyone's fair game when it comes to skin cancer. We're getting a lot of sun exposure, and also vitamin D. Everyone is deficient, like everyone. Like it's, if you go get like your blood test, like, I mean, I know I'm deficient. I know all my patients are deficient. It's, even though we live in a sunny area, nobody's sitting out in the sun for hours at a time. You really have to be out there baking to get enough vitamin D from the sun. So really, everyone should be using sunscreen, because the most important thing is actually that you're protecting yourself from skin cancer. And vitamin D, you can always take supplements. Okay. So you should actually, everyone should be taking supplements for vitamin D. Just depends on dosage.
That's good. I hope that answers your question. I'm going to ask this question to Dr. Dang and see if maybe he might know this. So Dr. Dang, can you tell us what is the best lip treatment or chapstick for super dry or cracked lips?
Oh man, actually, let me let Tiffany answer first, because this is her area of expertise, and then I'll chime in with something interesting afterwards.
Okay. Yeah. So for chapped lips, actually a lot of the best one is actually just using Vaseline or Aquaphor. By using like even the chapsticks that are like that you can get from like CVS, they're actually more drying. The more you use it, the more your lips are drier and drier and drier. So it's actually, and you don't want to use any chapsticks that have like peppermint or like those actually dry your lips out even more. So the best ones honestly is just using Aquaphor and Vaseline. They're going to do the best for you. So using things that have flavor in it and using like artificial ingredients will dry, it just continues to dry out your lips even more. So something simple is great.
That's very interesting. Mm-hmm. So in terms of lip balm, I read an article recently that actually mentioned that lip balm may actually help prevent the spread of COVID. And it does this by reducing the amount of water particles that come out as you talk. This is preliminary research, but it is very interesting that something that most people have can be helpful in fighting this. If anyone is interested, I'm going to link the article into the chat box. And remember, anytime I mention research, it's always important to analyze who did the research, what were their motivations for writing it, is there any conflict of interest? Also, the important thing about research is that you want to see these results replicated, because seeing one article with a result is not that strong scientifically. If you see multiple articles producing the same result, that's when you really want to start paying attention. So this is just preliminary research, but it is something very interesting. And as a general rule, anytime you do research, those are some things you should keep in mind.
Okay, thank you, Dr. Dang. Somebody here asked, how much sunscreen do you put on your face? So how do you know when too much is too much, or is it enough?
You just apply a thin layer to your full face. I kind of just like, I use it like makeup. So I kind of like put some here and here. And then if I feel like it doesn't cover my whole face, then I put on the rest. It's really like, I mean, it's kind of like I feel like a quarter size amount. If you have to put into like quantitative terms.
Okay, thank you. And then I have a question here from Maria. She asked, if you have acne on the chest, like what are some of the best, I guess, products, or what can you do to prevent that?
Acne on the chest, you would want to use like a benzoyl peroxide wash. So when you're in the shower, make sure like when you just apply it on your chest and then leave it on for like 5 minutes. It does take time for it to act, and then wash off. And then you can always use the same medications you use on your face for your chest as well. And a lot of it is also like, are you like working out and you're sweating through your workout clothes? And also like if it's not because of something like topical, like your clothes, or you might have to take like a antibiotic. So that's something that you should, if you talk to someone, a derm provider, that they can cater to your individual, like what's going on. But try benzoyl peroxide wash to start.
Thank you for that.
I had a question here from an audience member asking, I heard that peel off masks that extract blackheads and whiteheads are more damaging to your skin rather than helpful. Is this true?
Yes. So in the past, we always thought that you want to clean, if you have like skin, like pores, or you have blackheads, or you have oily skin, we want to over clean. Like you want your face to be like squeaky clean after, but that's not true. So when you do have pores, the best thing, or blackheads, the best thing to use for yourself is actually retinoids. So retinoids it increases your skin cell turnover rate. So by doing that, it also exfoliates your skin. And that will actually give you better results than using like a blackhead strip, because it's actually peeling off a layer, and it could be more damaging. So using topical ingredients like salicylic acid, AHAs, BHAs, retinoids.
Thank you very much. And someone asked, can you repeat the names of the specific retinol products you suggested during your presentation?
Oh, so the ones that were over the counter that I suggested was just Epiclar from La Roche-Posay, and then Differin gel. And just make sure, like, before you use retinols that you are medically okay to be using it.
A lot of side effects with using retinol products, and you're going to be screened massively because it can lead to a lot of birth defects, and it can also lead to some psychiatric issues too.
Yeah, so you just want to, that's more for like oral retinols, like the psychiatric problems. But with topicals, like, yeah, for sure, like you can't be pregnant, you can't be nursing. And then just like, I mean, I think you can start retinoids even like at the age of, I think 8 or 10. Don't quote me on that because I'm not 100% sure about that number, but just make sure like before you start that you are clear to use so. But those are also over the counter brands. So you can just pick it up if that's something you do want to try.
Thank you. I have a question here. This person asked, what are some treatments for hyperpigmentation?
So hyperpigmentation, you can use anything from skincare to using like getting procedures done, like chemical peels. You can do microneedling. And then like something for skincare, you want to look for products that have either niacinamide, kojic acid, AHAs, which is alpha hydroxy acids. And then you can look for BHAs, beta hydroxy acids. Retinoids will actually do really good for you as well because it's increasing the skin cell turnover rate. There's like shiitake mushroom ingredients, bakuchiyo. Those are all skin brighteners. So those are all options, and and vitamin C as well. So you don't have to just use one topical ingredient. You can find an ingredient, certain skincare that actually has a bunch of it. So one of my friends who's a dermatologist actually created a skincare line, and hers is called Oath MD. But in that product, she has one just for hyperpigmentation, and it has like kojic acid, niacinamide, it has bakuchiyo, like it has all the stuff that I'm kind of mentioning now in one product. So that's an option. Yeah.
Thank you. Z here asks, what brand facial moisturizer with SPF would you recommend?
I know CeraVe has one, but I don't actually use like a moisturizer that has SPF. Like I use a moisturizer and then I use an SPF after. But I know CeraVe has like the AM moisturizer that has SPF 30. So that's an option.
Okay.
Tiffany, would you agree that most people can just use something with SPF 15 and then something a little more strong when they go outdoors for prolonged periods of time?
I think SPF 30 is probably the lowest I would go. Like it doesn't have to be like 50, 55, like 30, as long as it's over 30, I think that's totally fine. 15's a little bit low. But if you're at home, yeah, I mean, like if you don't really have too much like sun exposure in your house, but even when you're driving or you're in the car, like I always try to go like at least SPF 30.
Okay.
Yeah.
Thank you. Jennifer here asked a really good question. She said, I noticed that a lot of your recommendations for skincare are American. Would you consider any international skincare options, for example, Korean, Japanese, or European skincare? And I think
Oh yeah,
I use Korean skincare for my skin.
Yeah, there's a lot of good brands. Like I don't know them by heart, but I know there's like Tony Moly and like Nature Republic. Like there's a whole bunch. Like I'm Asian too, so like whenever I go to like Taiwan or like I always buy their products as well. But the main thing is just knowing like what ingredient. The only thing is like I don't recommend those because I don't know too much about it. Like I don't know exactly what ingredients are in each one. But if you're using it and it works for you, keep using it.
Wonderful.
So don't change what's good. Yeah.
So Ciela here asked, what are your thoughts on all natural products? For example, paraben-free, phthalate-free, sulfate-free. Are those products better than products that contain chemicals?
So I actually was reading something like this on Instagram recently. I don't really remember exactly what they said, but they were saying that like the chemical-free stuff is not always better. So just because something has chemicals in it doesn't mean it's bad for you, and not all natural ingredients are good for you either. But the sulfate part, I don't like having sulfate in my ingredients. But when it comes to everything else, it's not when they advertise clean beauty, it's not always better. So don't just it's like a marketing scheme.
Very interesting.
Yeah.
So Pamela here asked, why are some expensive sunscreens only available in small amounts like a 1.5 fluid ounce, like those tiny ones? Are there any recommendations on body sunscreens that aren't sticky?
Oh, I like Aveeno. Like I feel like for body sunscreen, like Aveeno, Neutrogena, like those are all really good. And then there's also like the Alibaba, or no, not Alibaba. There's like it starts with an A, but it's basically a natural, like I think it's mineral sunscreen as well. It does leave you a white cast, but I think Aveeno and Neutrogena do a great job for your body. Usually like the stuff I'm talking about is mostly for your face. Yeah, I wouldn't use the very expensive stuff on your body. You're never going to use it.
And also,
you're going to want to like save everything.
Also, why is it packaged in those small containers? Because it gets you to spend more money. That's the unfortunate reality. They want your money, so they're going to package it in a way that makes you go through it quickly and spend money on their products again.
You know what's interesting though? Like I have a lot of those sunscreens that I mentioned on these slides. And like I've been using it every day, and I've had it for like 6 months now, like 6-7 months. Like I've been using it every day, and it hasn't ran out. So they're not that small.
The 1.5 fluid ounce ones?
No, it's not 1.5. I think the ones that I showed were like, they're definitely not 1.5 fluid ounce. I don't know what sunscreens they're talking about that are that little. But the ones I mentioned, I feel like they're bigger. Like they're pretty like this big.
Yeah.
And like they last a while. Yeah.
Thank you. So Kim here asked, I noticed that many people have been getting more into skincare because of TikTok. Most of the time people go for more of the aesthetic products. Is there such thing as any regular products, or are the more aesthetic products less helpful to the skin?
No, the more aesthetic products does not mean it's less helpful. There's a lot of really great medical grade skincare that you can get just like dermstore.com, or you can get at Derm Office, Med Spas. They all have it. It's just I always recommend those kinds of things when you're looking for like retinols, like serums, because I don't really go for over-the-counter options when it comes to that, just because like the active ingredient, I want to make sure it's good. I want to make sure it's medical grade. When it comes to like moisturizers and like face wash, I'm like, I feel like, I mean, I have all those nice stuff, and I end up using like the basics. Like I use La Roche every single day, and I have like very expensive cleansers because I just get them from work, and I don't use them as much. I end up liking the stuff that I recommended. So doesn't mean that it's not about the price. Let's just say price doesn't make things better. Like just because it's more expensive doesn't mean it's better. Like La Mer is very expensive, but is it good? I don't think so. I think it's very overhyped. So yeah.
What are your thoughts on coconut oil? Do you feel that do they clog your pore or your skin and can cause acne? or would it help retain moisture?
I would not use coconut oil. It's very, very comedogenic, which just means it clogs your pores. It not something that I would be putting on my skin. Use, like, if you really have dry skin, use Eucerin. Eucerin is another brand for like people who have very sensitive skin or eczema prone skin. It's very hydrating and it's a good moisturizer. They have cream options as well. So if you're really dry, use a cream. Cream moisturizers, there's like ointments, creams. Creams would be the one that you would want to use.
Tiffany, I have another question here. Is CeraVe Skin Renewing Retinol Serum a good retinol product to use? This person does not have acne, but they've read that retinol has other benefits. And is there a specific product that you would recommend for them?
So the CeraVe Skin Renewing one, I think that's the one in the purple container, which is, it has retinol in it and some moisturizer. I think it's fine. I've never actually used that one before. The thing is, like, I don't like to put retinol in my moisturizer just because I don't use retinol every day. Retinol is pretty irritating, and unless your skin can tolerate using retinol every day, I just avoid it. So I have like my own retinol product, and then I use moisturizer like on the side. But retinol is anti-aging, so it helps with wrinkles, it helps with your pigment, it helps with like your texture of your skin. So just because you don't, everyone should be using retinol. It doesn't matter. Like, even if you don't have acne, it makes your skin just look really nice and glowy. So yeah, you can use it. Just know that moisturizer does contain an active ingredient. So don't like use it morning and night. Like, use it just at night. You can use it every other night. Yeah.
What are your thoughts on Obahai? I'm assuming that's the name.
Obagi.
Obagi. Obagi. In the display case, is it worth the prescription?
It's actually not a prescription. It is just medical grade sunscreen or medical grade skincare. Most of the Obagi is like known for for pigment. I think a lot of their products have hydroquinone in it, so it's for people who have like melasma and like people who have hyperpigmented skin. I have heard that it does help, but I have also a lot of their Obagi brand for like just like regular, like their retinol and like their pore refining. And I honestly didn't feel like it did much for my skin at all. So, I mean, everyone's different. It may work for you, it might not work for me. So it just depends. Like, I can't tell you it's like worth it or not worth it. For me personally, I don't recommend it.
Tiffany, you mentioned a lot of great products. Now, are certain products more effective based on the season of the year?
I mean, you can, like, when it comes to like winter time, like your skin's a little bit more dry, so you can use more of like a cream and like a more like the moisturizer being a little bit more like heavy. And then like in the summertime, because it's a little hotter, like you can use like a more gel based moisturizer. But I mean, I don't actually change like my skincare through seasons, and also in California, I feel like the seasons are pretty similar. So like I really just use the same like year round. Yeah.
Thank you for shedding light on that.
Do you have suggestions on oils and serums?
Like what types of serums to use?
I assume that's the question that this person is asking. Yeah. Or what are your thoughts on oils and serums? Do people use them often?
I think oils are fine to use. I don't personally use any oils. I actually don't even use any toner. But for serums, like the ones that I use that I really like is there is a brand called Skin Better. It's an even tone correcting serum. I love any niacinamide serum, hyaluronic acid. I think it's great for acne prone patients. And then, and all acne prone patients, I always recommend niacinamide because it also helps with the redness that acne patients have, as well as the pigment. And then I also use this brand called Lumiere for their serum. So like when it comes to serums, I actually use everything medical grade. I don't use any over the counter serums. because that is my active ingredient that I'm putting on my skin. And I think when it comes to your skin and your face, like you should invest in it. Like this is what you have for the rest of your life. And it lasts, I feel like it lasts a while. So when it comes to investing in something good, I would say spend more money on the serum and the sunscreen. Make sure you have a sunscreen that you really like, because if you don't like it, you're not going to use it.
Thank you. And then what are your thoughts on the Goop sunscreen? I've seen that brand.
So that's funny. Like I know the dermatologist I used to work with, like, hated it. She was just like, I don't know why everyone's loving like Goop, Super Goop. I've never actually used it, but a lot of my patients love Super Goop. I don't know what about it is good, but we don't like, I mean, if you like it and you're using it every day, then keep using it. I just have never used it.
Tiffany, do you have any recommendations for people dealing with hair loss, and if there's any kind of shampoo that could help them?
So hair loss, there's many reasons that you could get hair loss. One, stress. Two, you can have a condition called seborrheic dermatitis, which is also known as dandruff. So when you have dandruff on your hair, a lot of it has to do with having like fungus. So using something like Head and Shoulders, Nizoral, Selsun Blue, which are all like over-the-counter options for your head, helps with that dandruff, and then it does help with your hair growing. But with hair loss, it's good to get a consultation from someone, because everyone's hair loss is different. Like I don't know exactly like what the reason why you're having hair loss, but there's like medical grade stuff too, like prescriptions like Rofade. A lot of people like to use PRP injections. But I would start off, like, if you do have dandruff, like start using like Head and Shoulders or something, and then get a consult if that's not enough for you.
Thank you.
Mm-hmm.
All right. Oh, and I think this is a really great question that would be applicable to everybody. Like, what are your thoughts on wearing the face mask and people breaking out when they wear the face mask? Why does that happen?
So that's like a new term that we called acne. So like it's acne caused from wearing masks, and it's actually so common now. Everyone's coming in, like even people who've never had acne like in their life have acne now. And it's because when you're wearing masks all day, you're causing like heat and like moisture to get stuck in that area. And then it's also creating more like bacteria in your skin. So that's why everyone's starting. It's called acne mechanica. So you're getting acne from something touching your face and like rubbing and the heat and the friction. So some things that I always recommend to my patients is, one, wear a silk mask or a cotton mask. Those are less irritating to your skin, and they're actually very protective as well with COVID. There's like been a study that wearing like a cotton mask that had a few layers and then like have a filter in between is actually the same as like wearing like a surgical mask. And also, if you're going out as like a normal person and like you're wearing a mask, someone else is wearing a mask, like you don't need to be wearing a surgical mask unless you're like seeing patients and you're like up close with them. And surgical masks honestly like make your face sweat a lot, so not the best for your skin. So I always recommend silk and then cotton mask. And then on top of that, I do recommend microcyn spray, which is spelled MICROCYN. It's something you can order from Amazon. It's actually a wound cleanser. So it's antimicrobial, and it helps with that bacteria that's getting caused from wearing a mask all day. So I actually use that as a toner in the morning and night to help prevent from like acne. And then also like making sure you wash your face when you get home. One thing that is irritating to wear a mask and use at the same time is retinoids and benzoyl peroxide. So if you haven't been using retinoids or benzoyl peroxide in the past, don't pick this time to start. Wait until like we stop wearing masks. If you've been using it all the time, continue. Because with how irritating those things are already, and then wearing a mask on top, it makes it worse. And it actually doesn't end up helping you out.
Thank you so much.
And then yeah. Oh, I was just gonna say, and sometimes you just need like actual prescription medication.
Hmm. So Tiffany, what is your take on the other types of face masks? Someone's asking about sheet masks or clay masks, like the popular Aztec Secret. Is it okay to use them regularly?
Oh, they're talking about like the face mask stuff. Yeah, I mean, I wouldn't use face masks like every day. I feel like that ends up being kind of drying. But I think like once or two times a week is great. Like I use clay masks all the time, like mud masks. I use like sulfur masks, which are really good for acne as well. Um, and I use it like one or two times a week. And I also saw someone else said something about like exfoliation or scrubbing your skin. I honestly would not exfoliate or scrub your skin. It there's chemical exfoliants, so you can use like salicylic acid wash or use like glycolic acid peels. I mean, like face lotions, or like they have these retinoid pads, which you kind of can like, it's like a little circle pad that you can use to like exfoliate your skin, and those are much better than using like face wash that has beads in it to exfoliate your skin. That's actually very it hurts your skin more than it's helping you.
Very fascinating. I didn't realize that.
Mm-hmm.
So, there's another question. Do you agree with fragrance in skincare as long as it is a wash-off treatment and not overly fragrance? What matters is what's inside the bottle, not what the bottle looks like. If it looks nice, then that's a plus.
I think that person was answering somebody else's question.
Okay.
All right. What about this question? Do you recommend trying to find a dermatology internship during college?
Honestly, I think if you want to be a dermatology PA or a dermatologist in the future, whatever you do before PA school is actually really important. So, or like before med school, because I didn't know that before wanting to be a PA, like a derm PA. But everyone in my interview, like after I already finished PA school, was asking me about my dermatology medical assistant job. And I'm like, what? Like, I'm a PA already. Like, why does it matter? Like, this is like that was like 3 years ago, 3.5 years ago, but they care. So when you have that experience, if that's something that you for sure want to do, like I would, like I get as much experience as you can as a college student. You have more time then than you will later on. So if you can, and also doing that might determine that you don't want to be a derm person. So it's always good. Like the more experience you get, never hurts you.
Tiffany, what are your thoughts on eyelash growth serums? Do they really work?
Yeah, I mean, I've heard Latisse, like Latisse works really well. There's also another brand that you can get when you go to like med spas or a dermatologist's office. That does work. Like I've seen people who've used it all the time and it's helped. And I've also heard like putting Vaseline on your eyelashes helps. I don't know. Like I've never actually tried it myself, but I have heard just like putting Vaseline on your eyelashes. Like my friends have like grown their eyelashes a little longer. But I do know like Latisse, it does help people. And like some people even put on their eyebrows if they want to grow eyebrow hair.
What are your thoughts on acne extractions, like those tools with the loop at the end, like the metal ones that you pick your face with?
So I think leave those to like a professional when it comes to like like I know it's really, really hard to like not want to do it yourself, because when you see a pimple, like you want to pop it, but that leads to scarring. And also when you use those types of things, most of the times you're not cleaning it as well as you should. So you use it on one pimple, and then you try on the next one, and like you're kind of contaminating. But if you go to like a esthetician, they keep things very clean and they can do like the acne extractions for you.
I definitely agree. Tiffany, what are your thoughts on skincare products marketed towards men, like all-in-one products?
I don't really know too much about that, so I can't comment too much. But usually, I mean, I feel like honestly with guys, like most guys, I feel like they get away with not doing too much with their skin and they still look pretty nice. So, so when it comes to that, I don't know, like I feel like guy skincare should not be different from girl skincare. The same products that I'm recommending is good for women and men. I wouldn't say like whenever they have like men's stuff, like I don't really feel like it's just a marketing thing. I don't feel like there should be, it's the same. We all have skin. We all need like exfoliants, like chemical exfoliants. We all need moisturizers. So everyone can use the same stuff.
All right.
I know you mentioned when we had spoken a few weeks ago, something about the St. Ives oatmeal scrub. Yes, can you elaborate on that a bit? Because somebody here asked, or somebody here said, I just started using the St. Ives Gentle Smoothing Oatmeal Scrub product, and it has those exfoliating little beads. Should I immediately stop using it? I'm scared. What should I do?
I would stop using it, but don't be scared, because I mean, it's not good for you long term, but we've all used St. Ives. Like I used it as a kid. I didn't know. I just heard more recently that like using those beads are not good for your skin. But like, yeah, I've used it. I think we've all used it. So yeah, I mean, I wouldn't be scared, but I wouldn't continue to use it. If you're trying to find something that is like, I'm assuming the oatmeal scrub product is not for your face because it's the smoothing. I don't know. But if you're trying to get like some exfoliation for like your arms, like for like keratosis pilaris, or like for something else other than your face, you can always use like amlactin, which is a moisturizer, and it has like lactic acid in it, and it helps with like smoothing out your skin.
Wonderful. Somebody here asked, how do you get rid of acne scars?
So acne scars are tough. It takes like a long time to get rid of it, and like multiple methods. So it just depends. Like there's many types of acne scars. There's hyperpigmentation from acne scars. There's boxcar acne scars. There's ice pick acne scars. Like it's just based off the shape of your acne. And every single one is a little bit different on how you treat it. So you do need a consultation, but there are options such as like fillers. You can put fillers into your acne scars that can help kind of create some collagen in that area and bring it back up. If you have very superficial scarring, like hyperpigmentation from acne scarring, or just like superficial ones, like microneedling is really good. Chemical peels for hyperpigmentation. There's also like TCA, which is a chemical peel as well that you can use for deeper scars. And then there's another option, which is using a needle to kind of go underneath the scar to break it up. And that's, I forgot the name of what that's called, but that's another procedure that you can do, because acne scars, if they're deep, they go very deep. So you need to fix what's underneath to break it up so that your skin can kind of like bounce back. Otherwise, everything you do on the surface level is not going to fix that acne scar. And then there's lasers as well.
Thank you. So Aria here asked, should you pop your pimples? So if you have like those whiteheads that are just bubbling up on your face, do you pop it right away and like push everything out, or do you leave it alone? What is the best solution?
Yeah, so I would not pop it. When you pop it, you actually increase more inflammation to the area. And it also increases your risk of scarring. And nobody, like, even if you could fix your acne and you still have scars on your face, you're not going to be happy. Like, so it's one thing to treat the acne, but it's also important to prevent the acne scarring as well as treat the acne scar. And then I saw Jennifer said try pimple patches. That's great. Like pimple patches are great. They're like basically circular hydrocolloid kind of dressings. And you just put it onto your acne, and it does help like kind of bring it out for you without irritating. So I think that's a good option, but I wouldn't go and try to like pop them. And if you have like, and then if you do have like a big one, you can always, if it's a cyst, you can always get a steroid injection. So if you go to like a derm office, you can just get a tiny steroid injection into it, and it will calm it down and kind of makes your pimple go away a lot faster.
Tiffany, do you have any pimple patch brands that you recommend?
I used to use one from like, I think Neutrogena or Bior had one. But honestly, I would just look up, like, let me Google some stuff. Yeah, I think Neutrogena has one actually. Yeah, so I would just look it up. They're like little circular ones. There's, I'm sure, oh, I think COSRX. I feel like I've heard of that one before. So yeah, I don't think there's like a specific brand that you have to use. They all work pretty well. Oh yeah, I'm looking at it. It looks pretty good. The brand that she said, COSRX. I don't know how to say it.
Tiffany, have you heard of any side effects with periorbital fat loss involving Latisse?
I have not heard about that, but I'm sure it's true. There's a lot of things that are not fully studied, but also Latisse is actually a glaucoma medication. So it started out as a glaucoma medication, and then as they were putting it in their eyes, they realized like people's eyelashes were growing. So with every medication, there is risk factors, and it also depends on how you're placing it. I think if you're really good at just putting it onto your eyelashes, it shouldn't affect your like fat loss on your eye area, but there's risk to everything. Every medication has their risk factors.
Tiffany, I had an audience member ask about they have keratosis pilaris on their upper arms. What should I be doing to help or treat my skin? And this is something that I actually have too. I also have keratosis pilaris, and I know a few other people that have it too.
I think we all kind of do. It's actually very common in Asian skin, especially. Like I have some too, but the keratosis pilaris is actually really hard to treat, and it's not all the time you can even fully treat it. But some ways to help with that is using you can use amlactin, which is it has lactic acid in it, and it's a moisturizer that you kind of apply to your full area, like full arm. And then you can also use like topical steroids if the doctor thinks that that is something that you should use, because it helps with the inflammation that keratosis pilaris has, as well as like washing your arms with like salicylic acid. I do really like the CeraVe. They have like a SA body cleanser. So I just kind of like rub it onto my arm, and yeah, like. And then there's like lasers that can help with it. You can do like a injection of steroids for the inflammation that also helps. But keratosis pilaris is something hard to treat and very, very common. And it doesn't affect, it's just cosmetic. Like you don't ever have to treat it if you don't want to. It's really just a cosmetic thing.
Thank you. I have, this one's a pretty long one. I'm going to read it to you. It says, allergies can develop at any age, and oftentimes many people are unaware that they have allergies or new allergies. Can allergies also trigger skincare problems in the long run if they aren't treated as soon as they start? How can people go about using certain products when they're unsure of their skin type and what causes their breakouts? Genetics can also take a part in acne and skin problems. Can stress also be a main factor for causing skin problems?
Yes, stress can cause skin problems. It can cause a lot of things. I mean, stress is huge when it comes to any medical problem, I think. If you're stressed out, things start to pop up, and acne for sure is one of them. And then you're saying with allergies, yeah, like people who are allergy prone, also a lot of them have eczema. There is that triad, which is like eczema, allergy, like seasonal allergies, and then like there's one other thing. Do you know what it is, Dr. Irving?
I'm sorry, what was your question?
So you know the allergic triad, the allergy triad, it's like atopic dermatitis, there's and then seasonal, asthma. Okay, so it's like asthma, seasonal allergies, and then the atopic dermatitis, which is eczema. So they do all come hand in hand. But when it comes to like being allergic to skincare products, I would just say what you should do is like do one at a time. Like if you want to try a new skincare product, try one for like a few weeks and then see how that does for you. Because if you try too many things at once, you don't know which one is the one that's causing you irritation.
I definitely agree. Tiffany, I don't know if you mentioned this previously, but are there any scholarships for PA programs?
Yeah, there are. There's a ton. There's like You can apply, like you can just Google like different types of scholarships, but one that I know is very popular is like the National Health Service Corps scholarship, which basically you sign up for working for like an underserved area, like location. So you have to find like an office that is underserved, and you have to work, I think, like 2 to 3 years at that office to basically they pay back your loans. So they'll pay for your loans 100%, but it's very competitive. I know I had some friends that tried applying for it and didn't get it. And I also have some friends that did apply and ended up getting it. But you also have to be willing to like go work, like they could send you out. So like if they find like an underserved office that is like 2 hours away from you, like you have to go. So that's something you sign up for. And you get really lucky if you find one that's actually near your home.
Well, thank you for answering that. Tiffany, someone asked, what can you do about hypopigmentation?
So hypopigmentation, there's actually this new thing that we have in the derm office, which is called extract laser, which is for people who have like vitiligo. Vitiligo is just when you have like full body like hypopigmentation at certain areas. So with that treatment, it's supposed to give you your skin color back. And then I know some people like tattoo it back, the skin color back in. But that's 2 things that I know about. I don't know anything else. What about you?
For me, yeah, hypopigmentation can either be from vitiligo, or I believe also there's also a fungal infection called Malassezia furfur that could also cause hypopigmentation, but that's more common.
Tinea versicolor.
Oh, tinea versicolor. That could, but I believe that's more oftenly seen in like tropical regions, and
it's actually common here in LA.
Oh, really?
Yeah. So tinea versicolor is like super common. It's caused by Malassezia furfur. And it's basically like little, like you'll kind of get it more like when you're like, you notice it when it's your tan, because like when you go out and then you get tan, the spots that are like, has that, the yeast actually is hypopigmented, and sometimes it is pink. So it's not always white. Sometimes you can see it like little pink spots. But that is actually due to a yeast, and you have to use treatment for it. And the hypopigmentation actually it goes back to normal over time. So after you treat it, it does take some time for that pigment to go back to normal, especially since the reason why you're even pigmented like that is because you're tan. So after your tan kind of goes away, eventually everything evens out. But when it comes to like hypopigmentation, like as a normal medical condition you have, it might be vitiligo, which I know that laser that we have in office is called extract. It does help with it. And then I've heard of tattooing your skin to make it look the same color. But there's not that many options for vitiligo. It is a hard treatment. Right.
And I actually, I know some of my medical school classmates that had that
vitiligo. Yeah. And it's vitiligo, I think it's autoimmune, right?
Yeah, it's an autoimmune condition that destroys your melanosomes, which produces the melanin pigment.
Yeah.
In terms of treatment for that, I don't really know too much about it, so I would recommend anyone suffering from that, please consult your doctor.
Yeah, I just know we offer extract laser. So I have heard that it does completely bring your skin color back to normal, but it does take like 60 treatments, and you have to do like 2 to 3 times a week.
Wow.
Yeah, but insurance covers.
Oh, that's fantastic. Yeah, that's definitely something that I didn't know about. Thank you for sharing.
Oh yeah, I just recently learned about it, and I found out because my office has it. So I was just recently getting trained in it, and I was fascinated too because I didn't know that you could even. I only heard of like tattooing before. I didn't know that there was lasers for it.
Tiffany, there's a question. When should you be using toner with your skincare routine? And are toners important to have in your skincare routine in general? I know we talked about this last time we met.
Yeah, so I actually don't use toners at all. In the past, I used to think like toners were super important, and I was like, oh, you have to like use a toner so that your pores kind of decrease in size. And then so when you put everything else on, it's not like clogging your pores. But I have learned that toners actually do end up drying out your skin more, and it's actually not something that you need in your skincare routine. So every dermatologist that I've met before have not recommended using a toner. So just use a serum instead. It's not necessary.
All right, I hope that answers your question. I'm going to throw this question at Dr. Dang. What is the difference between psoriasis and eczema? This person said, I have plaque psoriasis on my arms and legs. Is it due to factor, environment, or genetics?
There's a lot that I could talk about with eczema and psoriasis. I'm sure Tiffany can as well. So eczema affects about 30 million Americans. It has genetic and environmental risk factors. It can affect any part of the body, but is commonly seen where the skin folds come in contact with each other, such as the flexor surfaces, like right here, or like even under the armpits or areas on your leg as well. But it can affect the entire body. There is a link between eczema and other atopic diseases, such as asthma, rhinitis, and certain food allergies. Now, when it comes to psoriasis is an autoimmune disease that is caused by an abnormal growth of your skin, and it occurs in all age groups. There about 25-30% of people also experience some kind of joint inflammation. We call that psoriatic arthritis. But the most common is the plaque psoriasis. It has these patchy areas of raised reddish skin with like a silvery scale. So there are some differences in the presentation. Eczema can be intensely itchy, whereas psoriasis can cause a milder itching. People with eczema tend to be sensitive to heat, and that can lead to a flare-up, whereas with psoriasis, if sunlight is actually a therapy option for people with psoriasis. Mm-hmm. Tiffany, do you have anything you'd like to add to that?
I think that's good. You basically covered it really well.
Okay. Some treatment options will overlap in terms of psoriasis and eczema, and they involve corticosteroid creams. Sometimes you may need to escalate with some biologics that target a certain protein, causing the inflammatory reaction. And then if it's really severe, we have IV options for systemic treatment that could kind of suppress your immune system to help prevent that. So those are some of the differences between eczema and psoriasis.
Thank you. I hope this the next question here is kind of going to add, I guess it says here, how can you best care for eczema flare-ups near the face or the scalp?
So you would use steroid.
Steroid for sure.
Steroid. Whenever there's a flare-up, you use steroid to calm it down, and you use it for usually like 2 to 3 weeks, twice a day. But it's also dependent on what your doctor or your provider says. So everyone's a little bit different. But one way to prevent eczema too is after you use the steroids, you don't want to use steroids for the rest of your life either, because that is very drying and it thins out your skin. So one is use moisturizers all the time. You can use oatmeal baths and also bleach baths. So when you do have a flare, you can also use bleach baths. There's like you kind of use like a cup into like a full bath, and you just bathe in it for like 15 to 20 minutes. And that does kind of help kill like the inflammation. And that's helpful. But a lot of it is like people with eczema prone skin, you have to stay moisturizers. Making sure you constantly apply moisturizer to your skin. You can use Aquaphor, even like emollients like Aquaphor, Vaseline, like those are thicker ones, but those are totally fine. So yeah, like when there is a flare up, you can use steroid. And then if it's really bad, you can also use like steroid injection.
Besides Aquaphor, do you have any other brand recommendations for people with eczema?
I love Eucerin. Eucerin is just another brand for eczema prone skin patients, and it's a lot of people do like it. It's very hydrating. They have a cream, they have a moisturizer, and that's more for like daily use for preventative. Aquaphor, I feel like it's more like when you do have a flare up and you're like super dry, then you use like the steroid and then you use Aquaphor on top or Vaseline on top. And I actually like Vaseline more than Aquaphor because Vaseline's even more non-irritating. Some people, I think, are irritated to Aquaphor.
Could you spell out some of those things that you recommended?
Oh yeah, Houston.
Okay. Let me see here. Tiffany, what is your take on teens?
Oh, oops, I sent it privately.
Oh. Tiffany, what's your take on teens and makeup use? Because there's often a lot of chemicals. Is it safe to use as long as you remove it correctly for teens?
I feel like it's safe to use it for teens when you're using makeup. I mean, you don't really need makeup when you're so young. But if you are using it, just make sure you're washing it off well. Like I saw someone's comment about double cleansing. Double cleansing is great. So you can use like micellar water to first wipe off your makeup and then wash your face with like a face wash.
Okay. And then Tiffany, we have someone asking, what exactly is Vaseline? I heard it is a humectant and great for sealing in moisture.
It's a petroleum jelly, and I think
I don't really know too much of the background of Vaseline. I just know it's really, really good for moisturizer. I've always used it even as a kid. But it does seal in the moisture. So yeah, I think you're right about that one.
All right.
What are your thoughts on the Bare Mineral makeup products?
I think they're fine. I used some in the past. I feel like with makeup brands, I don't know too much. I think they're all like fine. Like I don't think there's like one makeup brand that's like better than another makeup brand.
Yeah. I had a question that I'm sure is on a lot of people's minds. What do you think about consuming collagen supplements for the skin and their efficacy?
Yeah, so I don't know too much about taking collagen, but when it comes to skin, by the time you're taking collagen as a supplement, like it's going through your whole digestive system. Like I don't think it's even like gonna do much for your skin.
Mm-hmm.
If you want something for your skin, it's better to use like a topical ingredient instead of like digesting it, because I think by the time it's absorbed, it really didn't do what you're looking for.
Yeah, I agree with that. In terms of collagen supplements, if you're consuming it, it's going to go through your stomach, and then your stomach acids are going to degrade the collagen. So the efficacy is questionable at best. So I don't really see how it benefits people by consuming the collagen.
Yeah, I feel like it's not widely studied, but I wouldn't be like, that wouldn't be my go-to recommendation for people. Like, I think there's so many other options for skin health. It wouldn't be take collagen supplements.
I definitely agree.
Mm-hmm.
What are your thoughts on lip masks?
I really don't know too much about it, so I don't use any lip mask. I just use Vaseline.
Okay. Any food and drink recommendations for healthy skin and hair?
I think you can take like biotin supplements for skin and hair. Make sure just to take the recommended dose. But when it comes to healthy skin and hair, everything you eat, your skin is the reflection of what you eat. You are what you eat. So if you have a healthy gut, then it will show on your face that you have healthy and good skin as well. Make sure you're drinking lots of water. Like a lot of times you can tell someone is dehydrated on their skin first before anything else. So drinking lots of water, eating healthy, make sure you take probiotics. Same things that you would do to be like healthy in general is going to make you healthy and it will show on your skin and hair as well. But I know biotin supplements is something that people do like to take for hair, healthy skin and hair.
Yeah, I love using the hair, skin, and nails since there's a lot of biotin in there. Oh, yeah. I'll throw this question at Dr. Ding. Do you have any advice on treating keratosis pilaris?
Keratosis pilaris. Tiffany went through a pretty good explanation on how to manage it. There's a lot of things you could do, such as the creams that contain certain types of acids in them. There's so many that I think it would just take up too much time to name them all. You can also moisturize, especially after bathing. That would be the most effective time to moisturize because once you put moisturizer on, it seals in that moisture from the water that you showered with. Vaseline, you could try that. You could also try some retinoids. I think that could also be an option, but of course you want to go see a professional before you start using retinoids. I think you could also avoid harsh soaps or soaps that are really drying. Don't vigorously scrub that area because it's going to irritate it. And is there anything else, Tiffany?
No, I think that was good. Actually, when you exfoliate a lot on like, even though like keratosis pilaris is basically like, that was me, sorry. Keratosis pilaris is when there's a lot of like keratin in your overproduction of keratin on your arms, or you can have it on your back, you can have it on your legs. So when you see those bumps, you think like, oh, let me like rub it and try to like flatten it out. But by doing that, you actually cause more and more bumps. So the main treatment is really to keep things moisturized. The moisture is going to help the most when it comes to this keratosis pilaris. And then also, I heard something about like some people thinking that keratosis pilaris has to do with like gluten and like being overweight, which it's not true, because I've seen people who are very thin and very healthy have keratosis pilaris too. So the cause is not fully understood, and it's kind of like you can just have it, like it's genetic as well.
Yeah, unfortunately, some of us got the unlucky roll, the genetic dice, and keratosis pilaris. And
it's just a cosmetic thing. It's really just not the prettiest thing, but it's not harmful.
How about what is the current medical knowledge of Demodex blepharitis? The eyelids, dry patches. Yeah, like what this person asked, what about the dry patches that swell around the upper and under eye area? What treatment works for that?
I don't know what she's talking about. Like,
is the question asking about Demodex causing the blepharitis?
Yeah, or what treatment works for Demodex or dry patches around the eyes?
Okay, Tiffany, would you like to start, or I can take it?
Demodex, are they talking about the Demodex mites that's like in rosacea?
I believe that's what they're talking about.
Yeah, so that's like really different from like dry patches, because rosacea comes out like usually like you have like red cheeks, and then like it can cause like kind of like it's kind of like adult acne, what they call it, but it just like you can have like pustules, and like when you don't treat it, you end up having like people have like rhinophyma, which is a certain look. It's a nose that kind of just like is more protruded, and it's caused from not treating your rosacea when it's not too bad. But it seems like when it's dry patches around the eye, that sounds a little bit more like eczema. So it's just making sure you're moisturized. With rosacea, there's treatments, many options, like their prescription, a lot of them, which is like Venetia, there's like sulfur washes that you can use. And then there's also like, you have to be really gentle. So people who have rosacea prone skin, you can't use like all types, like you shouldn't use retinoids. I think lactic acid is also a little too harsh. Like it's better to use like mandelic acid, azelaic acid. So really like finding out based off your skin type what you should be using, because if you're using like things that are harsh, it's not going to be helping your skin out, and you're going to be very sensitive.
So for the current medical knowledge on Demodex, like we mentioned earlier, it's a tiny little parasitic mite that likes to live around the hair follicles of the human body, or all mammals actually. And there's a lot of study going on about this. Some studies estimate 30% of people have Demodex naturally. Other studies show all participants, so 100% of the participants having Demodex. And it usually remains asymptomatic until there's something going on to cause your immune system to be suppressed. And some people just have a genetic predisposition based on how their immune system is to harboring these Demodex mites. And it is thought that there is some association between these mites and skin conditions such as acne and rosacea, like Tiffany mentioned previously. And another theory is that failure to wash your face and overuse of oily or creamy preparations can actually provide nourishment to these mites. But there's a lot of research still being done about this.
Yeah. And like rosacea, because we think that it's due to Demodex mites. And there's actually rosacea is caused by a few things. One is the blood vessels being inflamed. So there's medications for that just target constricting the blood vessels, and that's just for the redness of rosacea. And then another cause is the Demodex mites. So that's why we either use metronidazole, which is for that, or Soolantra, which is another medication that's great for rosacea for targeting those mites. And it just depends, like everyone's different. So like what works for you doesn't mean like one rosacea patient is not going to be the same as the other rosacea patient. But there is many causes to rosacea.
And for people that are wondering, metronidazole is an antibacterial, but it actually has effects on this parasitic mite. Another option, I saw that doxycycline can also be used for
doxycycline is another, it's an oral medication that we do give to patients with rosacea as well. So there's, and then Finacea gel. There is, I think Jennifer mentioned that Finacea is underrated, which is true because Finacea is amazing for acne and rosacea patients. And it's actually very, very helpful and non-irritating. So people who are pregnant are able to use it as well.
Very fascinating. Tiffany, I have a question that I've seen a couple people ask. What do you recommend for eye bags or crow's feet?
So retinoids, eye bags, you can also use like, there's like, I mean, I feel like with under eye, like or with crow's feet, people do like Botox. And that's honestly like the best treatment. But if you want to do something that's non-invasive, like no injections, then yeah, using retinoids will be helpful for, and then like making sure you stay hydrated. You can try eye creams. But also that's just part of the aging process. Like eye bags is because of not enough sleep. A lot of times, make sure you are well rested, make sure you drink a lot of water. That's going to be beneficial.
Thank you very much for that.
Well, thank you so much, Tiffany, for being with us today and for answering all of these questions. I know we've had you here a lot longer than we had anticipated, but we do appreciate you for giving your time with all of us today. Do you have anything else you'd want our audience to know on how to take care of their skin?
Nope, I think that was pretty good. I think we answered a lot of questions. And I did put like my Instagram and my email if anyone has any additional questions, or if you want to follow along. I do post a lot of like PA stuff, dermatology stuff, as well as kind of like my journey as a PA. So yeah, that's if you guys too are interested in learning a little bit more.
Would you mind typing that into the audience in case they didn't see that during the presentation?
Yeah, my cursor's not working right now, so do you mind typing it? It's just, it's right there, yeah.
Oh, perfect. There you go.
I got you. So Tiffany did provide her Instagram and her email there at the bottom. You can reach out to her if you have any questions at Tiffany WAPA. So Tiffany WPA. Sorry. There you guys go. All right, so again, this event is being recorded. We will be uploading it onto our YouTube page with the Los Angeles Public Library. Please do take a moment to fill out the survey if you haven't done so yet. I hope you know that we've been taking all of these surveys and trying to tailor it to your needs. So we hope that you enjoyed today's program. We're gonna go ahead and let Tiffany go. Thank you so much for being with us today. And Irving and I will stick around for the next 5 minutes to answer any last minute questions that didn't get answered. Okay, we appreciate you so much. Thank you.
No problem. Bye, guys.
Thank you very much, Tiffany.
Bye.
Bye.
All right. I think there's definitely some submitted questions that I definitely wouldn't mind answering because I think there are some important ones in here.
Go ahead.
Okay. Someone submitted a question that asks, what do dark skin colorations indicate in a person's health when these colorations are on the neck, underarm, and bend areas, which means like the areas that touch the skin, like the flexor areas I mentioned previously? So there's a lot of reasons for dark skin colorations. It could be just due to normal aging with liver spots. It's a common form. Another thing that can cause darkening of the skin is something we call melasma. It's darkening of the face area. That's often seen during pregnancy or in someone taking oral contraceptives. And it's due to hormonal changes. Oftentimes, those can go, though that will go away once the hormone levels reach their normal levels again. Freckles, age spots, other darkened skin patches can become darker over time, and especially with sun exposure too. So it could just have always been there, but it just got darker with more sun exposure or even as you age. Let me see here. Someone submitted a question about how to prevent and treat acanthosis nigricans in a young child. So for those that don't know what acanthosis nigricans is, it's a darkening of the skin and a change in the texture of the skin to something of a more velvety texture. This is commonly seen in children at risk of developing type 2 diabetes, and other causes of acanthosis nigricans besides diabetes would be ovarian cysts, maybe some adrenal gland dysfunction, even medications such as oral contraceptives or corticosteroids. Certain supplements such as high dose niacin could also lead to acanthosis nigricans. And also some people just have a genetic predisposition to this as well. One thing I want to note is that one of the most concerning things about acanthosis nigricans is that it could be a warning sign of a cancerous tumor somewhere inside the body, such as the stomach, liver, or the colon. There's no specific treatment for acanthosis nigricans. The main thing we do is to treat the underlying cause. So if you see this occurring in yourself or someone you know, please go get it checked out by a healthcare professional. Okay.
So Pamela here asks, is it possible to get the recommended vitamin D through foods if a person doesn't want to take a vitamin D supplement?
Absolutely. And I would recommend that over taking a vitamin D supplement. The one thing to ensure is that whenever you take vitamin D, always take it with some kind of calcium, because that will help facilitate absorption into the body. So yeah, there's plenty of ways to get vitamin D through your diet. Dairy is a very good option.
So Audrey here asks, can biotin supplements actually make a difference in your hair, skin, and nails? What products would you recommend?
I unfortunately don't know of any specific products to recommend for that. And in terms of biotin, yeah, I'm sorry, that I'm unable to answer right now.
I use the pink bottle that they sell at Costco. I think it's like Nature Made or something, and it does say hair, skin, and nails on there. For me personally, I notice a difference. My hair is softer, and my nails, they grow a lot like faster when I do take those kinds of supplements for biotin.
Okay. Someone asked me to explain again why pregnant females get darkening texture to their eyes, and that's mainly due to the hormones. The hormones are what cause an increased production of melanin, and melanin is what gives the skin pigmentation. Why it affects the face area in particular, I'm not exactly sure why, but it's something that will often go away once the pregnancy resolves or the abnormality in the hormones resolve. And then I had a question on what is fungal acne. So fungal acne, it's a misnomer. It's not really acne in the sense that most people think it is. It's a type of infection of the hair follicles by a yeast, and it's a yeast that's actually a normal part of your microbiome. It's usually kept in check by the other natural microbes in your immune system, and the only time it will really pop up is if there's something causing an imbalance in your immune system. And then certain environmental factors too could also lead to predisposition for fungal acne, such as excess moisture. If you work out and you're wearing the same gym clothes, that could also increase your chances of fungal acne. Certain medications, diet changes could also lead to fungal acne. And there are some ways to tell the difference too. You can tell the difference by mainly some of the ways is it would be by the size, whereas normal acne or bacterial acne, your lesions will be different size, whereas fungal acne, they'll usually be around the same size. Another thing is the location. While it can occur anywhere, fungal acne usually occurs on the arms, chest, and back, whereas bacterial acne, the face is most common. And also the presentation too. Fungal acne will pop up in like concentrated clusters, whereas other type of acne will be more spread out in its presentation. It won't be grouped together in like clusters. And then one thing to make note of, if you try to use anti-acne treatments, the standard anti-acne treatments, you're actually going to make your fungal acne worse. So that's when you would want to go in and see a medical professional to get that checked out. Okay.
All right. I feel like we've answered a lot of questions today. It was a very active group.
Right.
Yeah, very active group. It's my dog.
I think there's one more question here that was submitted that I think could be very important to talk about. Is it normal to have weird marks and spots on the face? Well, that sounds like kind of like a silly question. It really isn't. Like, so the main thing here is, do you have a sudden change in your skin? That's what you want to be the most concerned about, because a sudden change in the amount of moles or the coloration of your skin could indicate something going on that could be more serious. The thing I would recommend is if you notice any of these sudden changes to your skin, please consult a doctor immediately. A sudden eruption of a rash could be a sign of dermatomyositis, which is inflammation of your muscle and your skin. But the most common thing, or I'm sorry, the most concerning thing is that it could also be a sign of some kind of cancer going on in the body. There's actually a thing called lesser Trelow sign. It's the sudden eruption of multiple black spots on the body, and that is indicative of an underlying cancer somewhere in your internal organs. So please, if you notice some kind of sudden change or rapid change in your skin, please consult a doctor, because it could be something more serious.
That is really scary.
And it's not the most common reason, but it is the most concerning reason. So definitely get it checked out.
All right. I feel like we've definitely nailed it today with all of the questions, trying to answer everything. And if you're still here and you're interested in attending our next MedTalks program, it's going to be on the 21st. It's going to be our last one for this series. And we're going to be inviting a hematologist, oncologist, director to come and speak on diseases, cancers, and end-of-life care. So it's going to be a really good topic. I'll be sure to send out the invitation for that one. Don't forget to fill out the surveys for us so we can take all of that information back and come up with another great MedTalks series program for you.